My name is Manpreet Mundi, and by training I'm an endocrinologist, but my area of focus is in nutrition. And in my clinical practice, I really focus on patients who need tube feeding, parenteral nutrition at home, and also in the hospital. To describe Oley Foundation to a colleague, I would really consider it almost an oasis for patients who are not able to meet their nutritional needs by eating or drinking. And so these are patients who need tube feeding or parenteral nutrition, and they don't have anywhere else to turn to often. So Oley really provides them a home where they can learn about their disorder, meet other folks who have similar problems, learn from them as well, and then really, as an organization, have a resource to turn to when they have questions or need someone to fight for them. I've now been a member of Oley for a number of years, and I think it's made me a way better physician. I haven't found anywhere else where I can talk to patients or consumers in this manner. So as an example, often in medicine, we get a lot of training about the science of medicine through med school, residency, fellowship. We train a lot in that aspect, but it's very hard for us to get training about the art of medicine. And we often get that through years of practice and seeing patients. To me, Oley really provides that sort of contact with patients where I can learn from them, see what issues they're facing, and then use that in my own practice in dealing with patients with similar disorders and really treat them better, I think. So I've gained a lot from being a member of Oley. In terms of impact to patients, I think the biggest benefit that most get is that they no longer feel alone. So when you're given this devastating diagnosis that you can no longer eat or drink, let's say, that's, to us as human beings, that's such an important part of our lives that many patients start to retreat. So they don't go to parties or they don't go to any functions where they have to explain that they can't eat that or drink that. And so they really start to feel isolated and alone. But with Oley, you get to meet other consumers who also are dealing with the same issues. Many of them make lifelong friends this way and start to feel less isolated. And I've just seen them sort of blossom and become less depressed. So I think that's probably one of the most important impacts that Oley has for patients. Soon after I went to the first conference, we really made a change to recommend Oley to every patient. And at Mayo Clinic, we really teach patients quite a bit about whether it's tube feeding or parenteral nutrition. So they get a rigorous sort of education about how to manage their tube, their catheter, etc. And during that education, we tell them about Oley and give them information and recommend joining. So every patient gets this before they leave the hospital. I love participating in the Oley conferences. I get to really listen to a wide spectrum of speakers. This is rare for us because, as you can see from the conference today, there are surgeons here, there are dietitians, there are nurses, so all different multidisciplinary groups are present here. That's quite rare in academic conferences. So as an endocrinologist, I may go to a conference where it's just other endocrinologists. So Oley gives me a chance to go beyond just my narrow, field. So that's wonderful. And then the second part I love is obviously the interaction with the patients. I think I get stumped every time and have to go back and look, at literature or look up the answer for them. And often it leads us to actually do more research. So many times we've come to the conference and patients have asked about a certain aspect, and then we've had to go back and say, we don't know the answer to this, so let us actually, do the proper research study and try to answer it. So get lots of benefits, so I love coming each year. in terms of Oley, if I had any sort of parting advice for consumers, I would just say become involved. You're not alone. There are many here in Oley who are going through the same thing you are. There's also so many advocates that you have for you. So become involved, learn about what you're going through. And this is something I mentioned in my talk today. When you're on parenteral nutrition, take a picture of the label, ask questions. We love that as physicians and people treating, because it shows us you're engaged, and so we're likely to answer more of your questions. So ask lots of questions, learn about everything that's going on, and be your own best advocate.